can I really lose weight with these new injectable drugs on the market that I see all the commercials for? The answer is yes. But I'm going to go through in this video podcast. I want to talk about, can they help you really lose weight? Yes. But also, what are some pros and cons to consider about these medications? They call them GLP-1 or GLP-1 analogues or agonists, depending who you talk to. But you've known some of the commercials on TV with different trade names. I'm going to get into those in a second. But my purpose of this video is to give you a heads up, because I get a lot of questions from my people that follow us on RxHealthyHabits, and I'm going to jump into that mode once in a while of talking about, as a owner of RxHealthyHabits, what my personal opinions are. But as a pharmacist, as a professional, I wanted to give you the skinny on this class of medication, because I'm kind of jazzed about them. And people would say in the weight loss field, well, why would you be encouraging something like this? Because they work and they might give somebody a leg up. So let's go through this. And again, as a pharmacist, I got a pretty good understanding of type 2 diabetes. We have 3 type 1 diabetics in our family, so we know a thing or two about that. But we also know a thing or two about weight loss. So this topic intrigued me because it's about diabetes, which is 1 out of 3 Americans are pre-diabetic in this country. Anybody over the age of 45 is pre-diabetic, which means they're circling the drain to becoming type 2 diabetic. So this is a huge, huge issue. So if there's a way to help patients in this area, then I'm all for it. But and as for weight loss, we'll talk about that. There's some big benefits there too. So GLP analogues, what are they? Well, they're really a hormone secreted in the intestinal tract, and what they do is they help increase insulin secretion. They help reduce the release of glucose from the liver, because they're what do they call them? Glucagon-like peptides, and they can block that whole thing. Because once glucagon's triggered, then you get a dumping of glucose into your bloodstream. They also slow down the emptying time, and that really helps reduce appetite and promotes a feeling of fullness. So that's how they work. And they are drugs that are relatively new to the market. Now, right now, in the marketplace, the current brands available approved by the FDA, there's several. Now, these are all approved for the treatment of type 2 diabetes with a side effect. I'm going to say that. The big thing that they can't make a claim that this is for weight loss. They can say this is for type 2 diabetes and low your A1C below 6.5, but it also might help you lose weight. So they can throw that in there. If you notice on commercials, they do that. Bayetta is one that first came out. I remember this drug came out. This was a once a day medication. So this was one that was fell out of favor because the ones that were long acting, that last once a week, you inject once a week, really took over. But right now, the average cost that's about $750 for a 4-week supply. Bydureon is the extended release form of the same medication, and this one is about $1,200 a month for a 4-week supply. There's a drug called Victoza, which I did a lot of studies with. That's a trade name, and that one's about the same amount, $1,200 a month for a 4-week supply. Ozempic, which you've heard about, this is a big one, and we'll talk about how that's differentiated now with some of the other ones. Trulicity, that's a very popular one, and Rybelsus. Now, Rybelsus is an oral medication, so this is a big step up. If it works the same as the GLP analogues, interesting that the oral medications are now there. Then there's a newcomer to the block called Mounjaro. And again, these are all indicated for type 2 diabetes treatment. Mounjaro, you're going to see in a minute. I'll tell you right now. That also has another indication for treatment for obesity. And that's the only one on that list of everything I just went through. Now, there's Mounjaro, and there's also Wegovy. And Wegovy is the same thing as Ozempic, except it's indicated by the FDA for the treatment of obesity. So it's got separate labeling. And the dosing is going to be a little different on this one versus Ozempic. So now that one's about $1,300 a month if you had to pay out of pocket for the Wegovy. And the Mounjaro is about $1,400 to $1,500 a month, a little bit more. But that one's also out there pretty pricey. So I mentioned those prices, but I know if you have insurance and your doctor has an indication, an ICD-10 code, he might be able to get away with using some of these for obesity. But it always usually has to go through insurance for prior authorization. But here's the other thing. I just want to make a comment about price. Don't quote me on $1,200, $1,400, because a lot of the companies out there, the pharmaceutical companies, have all kinds of deals where you can get a coupon, you can get all kinds of discount, patient assistance programs, especially when you get started. Why wouldn't they? Right, of course. So that's very popular that some people don't pay that out of pocket if their insurance doesn't cover it. And the insurances many times will cover it for obviously for type 2 diabetes, but if it's for weight loss, the ICD-10 code, that code that they have to put in there, especially for Medicare, has to match what they're using it for, else it might not be covered. Now, I want to go to talk about two quick trials that I just want to mention two large trials that they did, and then I want to get into some of the advantages and disadvantages. I want to try to wrap this up in 8 minutes. I don't think I'm going to make it, but there's a lot to unpack here, and I'm looking at my notes because there's so much here. As a scientist, I don't want to get it wrong. But the first trial was a leader trial, 9,000 individuals with type 2 diabetes, and they found with using the drug Victoza, they treated that, and they saw a significant reduction in cardiovascular events such as heart attack, stroke, and cardiovascular death by 13%. Pretty good, right? And they also saw a significant reduction in A1C below that 6.5 level. And the average weight loss over a 3.5-year period of time was 9 pounds. So that's pretty significant. So that's one trial. Now, another trial was 3,000 people. This is called the Sustain 6. And this one, they did it with a different drug. I think this one they used, let me make sure. Yep, they used Ozempic in this trial. And they found a reduction in the cardiovascular risk of 26%. And reduced A1C, of course, brought that down for the type 2 diabetics, and a weight loss of 10 pounds over a period of 2.1 years. What I found from most of the studies I saw is you can look at anywhere from a 5 to 10% reduction in weight. You should see that around month 3, but then it doesn't really keep ratcheting down. Now, you can increase the dose, but there's downsides of that we'll talk about in a minute. But typically, that's what you're going to get. You're going to get a 10% reduction. And because of that, you get a major reduction in cardiovascular risk, which is significant. Now, let's talk about advantages. These medications are very effective at lowering blood glucose levels, especially postprandial and fasting morning blood sugars. Kind of interesting. That's very significant because some medications lower your blood sugar and you get hypoglycemic, not these. They promote weight loss. We just talked about that. Anywhere from 3 to 10%. Not everybody gets the huge drops, and that's off your initial body weight. We talked about the cardiovascular events, major. They're well tolerated. Now, there is a downside to them that we'll talk about, but they are well tolerated overall, and they're safe. There's a lot of options available, and the new oral option is really it's catching some speed on that one because people don't want to inject themselves. So disadvantages right up front. Cost. If it's not covered in insurance or if you have a high copay, that's a real bummer for a lot of patients. Injection site reactions, obviously, anytime you're injecting something. Nausea and vomiting are a big concern for some patients, but typically what I find with my patients is over time that usually gets a little better. But yes, that's part of how it works. It slows down the gastric emptying and also gives you a feeling fullness. So there is a little bit of nausea that's associated with it. Pancreatitis, very rarely there is some pancreatitis, but it's out there. And here's the thing, there's limited long-term data on effectiveness for weight loss and glycemic control long-term. Although glycemic control is pretty much dialed in, but long-term effectiveness for weight loss, there's data that's somewhat still limited. We need, 10-year studies, and we need it broken down a little bit more in detail. I'm sure they're going to do that. So I'm going to wrap this up. What do you want to do? You want to consult your doctor and weigh the pros and cons of using these. Now, for type 2 diabetes, and maybe you're a little overweight or obese, it's a no-brainer. I think he's going to say, let's go with these. It's irrefutable. It would make sense. But again, it depends on your situation, and he has to make that decision, he or she. But I think it's a no-brainer for that. Now, what are some of the pros? Well, we talked about some of those, but one of the things that I thought was the most interesting is that overall, the pros are that it's safe, and the pros are that it's going to reduce your cardiovascular risk, and that's huge, I think. And I think one of the pros are, I'm going to throw this in there, anytime you can show somebody a 10% weight loss, they're jazzed. They are pumped up, right? And I think that's a good thing. So, cons. I would say the expense is the biggest con for most people. That's a minus column. The expense for a lot of people is really crazy. And I think the other thing I would say is the nausea and vomiting is a little bit troublesome in the beginning, especially if they go up in dose too high. That's a little bit troublesome. Overall, what do I think about it? And maybe people are saying, I don't know if I really care what you think about it. Well, when it comes to type 2 diabetes that have some weight to lose, this is a good start. And I want to stress that. In my opinion, why not see a 10% drop in weight and you say to yourself, hey, I'm on the right path. I've never been able to lose that weight in years. Now I'm going to really dig in and find out how to lose weight. Because here's the thing. If you're a type 2 diabetic newly diagnosed, there's a chance, if you get to normal weight, a good chance, we can put that in remission. Not get rid of it. We can put it in remission, which means you still have to be followed, by your provider. But think about this. What if you could put that in remission? You're not going to get that typically with a 5 to 10% weight loss. So am I jazzed about these meds? Yes. But I tell my patients, and I also tell my customers or my clients at Rx Healthy Habits, you really need to think about getting to normal weight. So a 10% reduction, if you're at 250 pounds and you come down to 225, but you're supposed to get to a normal weight of 175. Guess what? Until you get there, probably you're not going to be off and be in remission for type 2. Now, last thing, when it comes to treating weight loss with these medications like Wegovy, Mounjaro, good choices. Why do I like them? Because you can show somebody some results right away, and they can see their weight coming down, and they say to themselves, man, this works. Now, can they sustain that? Can they stay on it? Is there studies that show that you keep ratcheting down? The answer that I saw so far is probably not. You're probably going to plateau with that medication, with those medications, and you're going to pretty much stay there. But ideally, and we all know this, until you really change your lifestyle of diet and exercise, eating less, exercising more, you're probably not long-term going to be able to sustain a weight loss and be truly managing your weight effectively without radical, significant changes to your lifestyle. And that's one of the things that somewhat concerns me about these, although I like the fact that you can show somebody some results. What concerns me is long-term, the answer is diet and exercise, eating less, eating the better foods, and really getting into some moderate to vigorous exercise, so 150 to 300 minutes per week. That's the game right there. So anyway, hope this information helped. This video podcast is intended, just to give you some answers. My blog on Rx Healthy Habits goes in a little bit more detail. I think that's going to be very helpful. That's RxHealthyHabits.com. And also, I really encourage you to sign up for our newsletter, because once a week you get a newsletter that comes out on a topic that I think you're going to find helpful. So until the next video podcast, stay healthy, get stronger, and really find a way to battle the bulge and lose weight. So until next video podcast.